Hello, everyone. My name is Ricardo Lynch. It's 2:31, so we're going to kick it off. I have this pleasure of introducing the speaker for today. I am the Salesforce Healthcare Account Executive, overseeing the Tableau relationship for Ontario and Atlantic Canada. And first off, I just want to thank you for joining our session today. It's apparent that data analytics is a huge impact on healthcare, where it supports anything around COVID, streamlined operations, user predictive analytics to reduce hospitalization or limited intensive care stays. There's so many applications to that. That said, it gives me great pleasure to introduce Matthew Murphy, the Chief Data Officer of Nova Scotia Health Authority, who will be presenting today on purpose-driven analytics. Matthew has been a key stakeholder, thought leader for the Health Authority, leading major initiatives and around data analytics. And Matthew and team continuously provide invaluable support to many areas of his organization to enable and support data-driven decisions, which is key in our industry. So just a quick note before we get going, I hand over to Matt. His presentations are around about 25 to 30 minutes. I just ask that we hold all the questions to the end so we can get to the presentation, and then we can answer all questions in order of receiving them. With that said, thank you, Matthew, and I hand it over to you.
Great, thanks, Ricardo. And I will say, anytime I hear anybody introduce me, I always assume that they are talking about somebody else, but I appreciate your kind words and the opportunity to speak today. Thank you, everybody, for joining my session. As Ricardo said, going to walk through Nova Scotia Health Analytics environment and really highlight some of the ways that our partnership with Tableau has driven analytics throughout the organization. So just to start, I do want to acknowledge that I'm presenting to you today from Mi'kma'ki, which is the traditional, ancestral, and unceded territory of the Mi'kmaq people. So within Nova Scotia Health, we pride ourselves on being a data-driven organization. Getting to this point has not been easy. It has also not been particularly quick, but it has been exceptionally intentional. For the last 7 years, we've made very specific strategic decisions around financial investment, governance decisions, and structural organization to ensure that our vision of enabling an organization where data is core to every decision has come to fruition. Part of achieving that overarching vision has been to define a very clear objective around analytics. And so within Nova Scotia Health, our specific objective is really about producing something tangible. So people talk about analytics all the time. It's a wide-ranging spectrum, but for Nova Scotia Health, it really means taking the reams of available data that we have, organizing it, analyzing it, sharing it, and ultimately driving insight throughout our organization. Later in the presentation, I'm going to call out explicitly how we've used Tableau as a key partner and enabler to make this possible. But for now, I just want to highlight that it is absolutely essential that within your organization, that you have some manner of visualization platform to bridge that data to insight gap at an enterprise level. So within Nova Scotia Health, we have a very specific analytics model. We use a bimodal approach to analytics. So it's split between my team, which oversees analytics through strategy and performance, and our business intelligence team, which is part of our information management, information technology portfolio. So two different reporting structures through two different vice presidents come together to really make this a successful analytics endeavor. Excuse me, and I also can't speak. So within our analytics model, we do divide responsibility. So our business intelligence team is responsible for the two lobes on the left, so infrastructure and data management. Our analytics team oversees the lobes on the right-hand side, so analysis and the actual organization of analytics throughout the organization. And then governance is a shared responsibility. It doesn't make sense for any single team to oversee governance because how we access, share, use, destroy any aspect of data, it has to be more than just one team. For the actual governance model, it is analytics and IT. Ultimately, though, when we look at defined users, we do clearly go out beyond that to our end users. One of the major benefits in taking this bimodal approach to analytics is, in my opinion anyway, leveraging up available and appropriate expertise. So for me, it's about having my analysts able to focus on data discovery, data exploration, and from that, once they've defined key reports or visualizations, passing that across to the business intelligence team to do more of the canned approach. And so that will be key, I think, for many organizations, not having just one single team take everything at once. So not unique to Nova Scotia, but certainly present for us. There are a variety of steps along the analytics continuum. When people start along this journey, you live in that descriptive world. So what happened? I will actually say that within Nova Scotia Health, when we started, even that descriptive may have been, we might not have been on that step just yet. We may have been looking at the staircase, trying to take our first step up, living in the world of Excel spreadsheets, but with key aspirations to go up that journey from descriptive straight through to prescriptive or cognitive analytics. We're not there yet. We're into the blue part, so working in the world of predictive analytics, but with our eyes ever present toward the prescriptive side. Apologies. So one of the other things that we've done in Nova Scotia Health as we've kind of gone along our analytics journey is to really stop and take assessment of the analytics maturity within the organization. There's a variety of different models that you can use to do this. We're actually in the midst of kind of changing horses mid-race, if you will, and looking at probably using the HIMSS model going forward. But we've used this to benchmark where we have been and what steps along our analytics roadmap we need to take to continue to move from one stage of maturity through to the next. So when we came together in 2015, I should have commented that my organization was previously 9 organizations that amalgamated in 2015 under a revision to legislation. Really we're in that kind of nascent area, pre-analytics. Decisions weren't driven by data. They were really based on gut instinct or kind of clinical intuition, which may or may not be described as gut instinct. And over the last 7 years have really been purposeful in how we spread access to analytics, access to data, and as a result have moved past early adoption well into corporate adoption. So I am confident and capable to say that we have an enterprise-wide analytics team, as well as enterprise-wide uptake of analytic product and incorporation into decision-making. We still have work to do. So we do want to become a fully mature organization with respect to analytics, where we have fully executed on that self-serve environment and integrated analytics into each and every decision. We're getting close in terms of integrating data into every decision, but the ability to really pull all of the core tenets of data into one specific decision, analyze it, and know for sure it is the best possible outcome remains a step just out of reach. So one of the things that we've been very specific about in Nova Scotia is defining an integrated analytics strategy. Depending on your organization, you may have a central decision support team or a federated team. You may have analytics in individual programs. We have made a very specific centralized analytics team and drawn on all of the different corporate or strategic data assets to draw into a single integrated enterprise data warehouse. By doing so, we're able to identify the key programmatic areas that drive decisions across Nova Scotia Health and identify where we may have strategic data gaps, and then use that to prioritize either the harmonization of data sets or the acquisition of new data sets over a specific time horizon. One of the real valuable or the true benefits in doing this, we've been able to draw financial information, workforce information, clinical utilization information into a common area. And so when we are making decisions or when we are telling stories to our executive, you're not coming with 3 distinct silos of information. You can actually put that integrated package together to show this is the impact of the decision. This is how it has hit our workforce. These are the financial implications of a decision. This is the expected change in workload. Over the last 2 years, 1 year in particular, we've really been driving towards how do we use that information to drive clinical research. and that will remain a consistent priority for us as well over the coming year. So one of the major kind of cultural issues we had to tackle within Nova Scotia Health at the outset of our journey was the perception of data, and that it really was viewed as a luxury. So the idea that only specific people could have access to it, you could only use it at specific times. And we've really fixated on shifting that culture to view data as a utility. So we try to think about it as water. Everybody needs it. Everybody should have access to it. It is a core, it's a core tenet to everything we do. That's easy to say and harder to do, and there is no magic sauce or magic bullet that gets it done. It quite simply is a driver you have to iterate over and over, or reiterate over and over. So everywhere we go, we talk about the democratization of data. We talk about the fact that it is necessary for individuals to have access to data to do their job, that you really have to justify why information or data should be kept private as opposed to made public within the organization. And that culture shift has been really important in allowing the integration of information from various programs and portfolios to proliferate throughout the organization. So the actual team, when I took over as the director of analytics 7 years ago, we had a team of about 7 decision support analysts. We are now 50 plus strong, spread across the entire province of Nova Scotia, and provide data and analytics to drive decision-making throughout the entire province. We have diversified the skill sets of the team members. So we have moved into the world of workforce reporting, so drawing on people with strong backgrounds in HR, moved in the world of applied analytics, and brought in individuals with PhDs in either math or statistics, or I specifically feel the need to call out one of our members who has advanced degrees in computer human interface, which I didn't even know you could go to school for, but it's a tremendously valuable asset. But we also have individuals who have a background, aligned with community college degrees and are more supportive of some of the data management rote reporting processes. And then also individuals who've come through health information management backgrounds, and so would be really familiar with the CMG Plus methodology, really valuable from a clinical analytics perspective. It's been really important to diversify the team over years to help identify to the organization all of the ways in which analytics need to support decision-making, that it's not just about what patient is in the bed right now. It is about the financial implications. It's about the workforce implications. It's about understanding the long-term population health outcomes and impact of decisions. And in order to do that, you need to have a strong, diverse workforce. In terms of the services, and I put this slide in specifically because it's going to help me talk about visualization shortly. There's nothing particularly unique about the services offered by analytics within Nova Scotia Health. We do data extraction and staging. A significant amount of that should sit within the world of BI and our IMIT colleagues. Based simply off of the current composition of the team, we do continue to have some of that work reside on our side. Data linkage, again, from a bimodal perspective, can and should be viewed from an IT perspective, but does continue to be a core requirement for the analysts to undertake. But then we get into the analytic output, so doing descriptive statistics or analytics, diagnostics, predictive, and applied, which I'm going to finish with a case study at the end of my presentation about the formation of the applied team within Nova Scotia Health and how we've used that to address really specific business problems, and then use Tableau as our visualization tool to simplify machine learning algorithms and AI into a format that an executive can understand. So from an analytic process, so this is how my teams work. We access information, we analyze it, visualize it, publish it, and then collaborate with our end users to really make sense of it. So although I am a full proponent of self-serve analytics, I also think it's essential to have analysts present in executive conversation to help troubleshoot potential misunderstandings or really drive home what insight might be available. And in order to do that, it is extremely beneficial to have a tool like Tableau that allows for meaningful and visually appealing, sorry, this is redundant, but visualizations. I will say 3 years ago, I may have had a different tune. I strongly disagreed with the fact that you need to make really eye-catching visuals for an executive to understand what you're talking about. I will say over the last 3 years have really come on board with the idea that a picture is worth more than 1,000 words, and a really well laid out dashboard that simplifies tens of thousands of rows of complex data into a really clear decision is worth A, more than 1,000 words, and B, more than the cost that it will actually, like the financial cost of purchasing that software is worth so much more than that when you start to look at your return on investment. So when I took over my role about 7 years ago, we lived in the world of Excel. We did not actually use Power Query or Power Pivot, which I have borrowed the icon for demonstrative purposes. We moved over kind of the first couple of years into larger spreadsheets, needed to use Power Pivot or Power Query to be able to structure and understand information. That is a really powerful tool, and I will never speak ill of Excel. It's an excellent tool to have. It's also not enough if you want to run an enterprise analytics program, particularly in a full province with 25,000 plus staff providing service to a million plus population. It's all about efficiency, right? So within my team, we were spending weeks, days, months, I know that that's not sequential, but on the information management component. So every quarter you needed to run new reports, but you had to undertake the same processes in Excel. If we had team members who could write macros, that made it easier for sure. But a lot of people didn't work with macros. It is still a specialized skill set. And so we were spending a significant amount of time on kind of rote transformations just to arrive at a more simplified spreadsheet, ultimately to a graph. Because all of our time was being spent there, we didn't have very much time to actually analyze information and arrive at insight. So several years ago, I had the great fortune of interacting with Ricardo, who was kind enough to give me my intro. And we started down a really specific small scale pilot with Tableau, looking at how we might be able to onboard 1 or 2 data sets from my analytics team and from finance, just to test the waters. And we have not looked back, and we are now enterprise-wide, server-based, server add-ons, and the reason I'm here talking about this is because it is so incredibly productive and effective at the enterprise level. I should have said this up front. I don't have a conflict. I don't get speaker fees from Tableau. I just genuinely believe that this is an excellent product, and it has been transformative for Nova Scotia Health. And so I like to talk to people about how we used it and how that happened. So this is, for anybody who uses Tableau, a overly complex Tableau flow from Tableau Prep Builder. That being said, it is also basically an awesome ETL process for my team. So without having made investment in ETL technology as yet, we have been able to leverage the Tableau Prep Conductor, Tableau Prep Builder to do the necessary data transformations to take our 9 major clinical information systems, our 900 and some odd clinical applications, and arrive at harmonized, unionized data sets that form meaningful visualizations that individuals can understand and use to drive decisions without having to take 2 or 3 weeks of kind of in-depth data manipulation in Excel or in another type of spreadsheet environment. I will be the first to say that this is probably not the prep that you want to see when you go to run one. You probably want fewer transformations and joins, but this is a means of automating each one of those steps without having to write a macro. So somebody like me who is not technically inclined, I trained in research, can figure out how to drag and drop and make the meaningful data transformations by using this aspect of the tool. It is incredibly functional, and I cannot speak highly enough of how this one piece radically changes your team. And so with that, so understanding that the ETL process can be captured by using Tableau Prep, suddenly the visualization component of my team becomes so much easier. So instead of spending 3 weeks to get an Excel sheet in place to then make a single run chart, we hit run on our prep flow in the morning, or we automate them through server and now don't even have to hit run. And all of a sudden visuals are done. And so we moved away from, you'll see on the kind of the right-hand side of my screen, we used to have online-based repository of images. Again, took us weeks to produce this information, would have it posted in time for end of quarter. And really all we were seeing was that quarter's result. So one more dot on a run chart or on a line graph or a histogram. We're now updating our information every 2 to 3 hours and updating our visuals on the fly because we've been able to automate that through the server management add-on within Tableau. I think it's really important to kind of stop and think through what I just said. So we have not spent a ton of money. We have not made major investment in technical infrastructure. We upgraded servers. We do have licensing through Tableau at an enterprise level. It's not free, but it costs less than it would cost me to hire 3 analysts to have accomplished all of this. And the return on investment from an hour-by-hour perspective is almost innumerable. And it means that we actually spend our time looking at our dashboards, understanding what changes are happening, conducting underlying analysis to identify the key system drivers that we wish to change. None of that was possible before. All of our time was spent trying to be able to get a graph ready to be able to go to board or to go to exec. So I really just actually wanted to show a visual because this updates every couple hours automatically. If you haven't worked in Nova Scotia Health, this maybe is not as meaningful a visual, but like this is looking at admits in the ED, it's looking at occupancy, it's looking at long-term care impact, it's giving me the pressures in the ICU, it's showing me what available beds by site within a specific zone, it's showing me where we have long stay patients, it's showing me the individual units and whether or not they are over capacity. It is color coded, so my eye is drawn immediately to the fact that the medical units are over capacity, that Dartmouth General Hospital has 12 patients sitting in their ED. And I have to wrap up very quickly because I have a deputy pinging me. So I apologize. I'm going to jump through a couple more slides very quickly and need to disseminate this. I do apologize, but a deputy minister requires my attention. So wanted to highlight that the sharing of insights through the platform is a significant boon. Make it available through server, so regardless of where you are, you can log in. You don't need to be on the network to do so, as long as you have some means of authentication. We're moving into mobile right now so that we can check surgical throughput on our phone before we come into work to understand whether we are achieving business case requirements. And I mentioned this in the beginning, and I do apologize, I have to cut my presentation short. This is not according to our timelines, but c'est la vie. Having a visualization tool is absolutely essential. You cannot get this type of information to your organization without some means of visualization at this point in time. It is an absolute expectation to have something in place. It is not a significant investment to do so. It will literally overhaul how your analytics team functions and how your organization is able to digest and ingest information. People go cross-eyed staring at spreadsheets unless they happen to be analysts or accountants. People do not go cross-eyed staring at dashboards. They are visually appealing. They are easy to follow. You do have to have some finesse in your creation thereof so that people can understand what they are looking at. But to empower an organization to shift, to actually uptake analytics to be able to benefit from them, you need to have this in place now. Like it is an expectation. We live in the Internet of Things. Sending information or reports through Word or through God forbid, an actual paper-based report just is not acceptable in this day and age, and healthcare is undergoing a digital transformation. This is a foundational, albeit entry-level step And so with that, I sincerely apologize. I was going to walk through one last item that shows how you can use Tableau to visualize really complex information in the world of machine learning and AI. I will disseminate my slides and make myself available for questions via email. I'm going to put that into the chat right now. I will put Ricardo on the spot to say if there are specific questions about Tableau. He will be able to answer those, and I significantly appreciate your attention. I apologize for my brief departure, and I wish you all the best. Thank you.
Matthew, thank you very much. Although it was cut short, I got a lot of information from that. I hope the audience did as well. As Matt suggested, I can hang around, answer any sort of questions around Tableau. I won't try to step in and answer questions for Matt. He's made his information available. And let me take a look at some of the chats so I can field some of the information. All right, just give me a second here. So has Tableau partnered with other provinces? Many provinces are users of Tableau. I can't imagine any province that isn't a user of Tableau. By partner, maybe you can provide more specifics around that idea of partnering. Do we have vehicles at the federal or provincial level? Yes, we do. But some more details around partnering would be need to be provided. Can this capture DICOM or information around HL7 only? The type of information, and this is a larger question. The way in which you want to transmit data or upload data into Tableau. There may need to have a larger architecture question or conversation around that, especially if there's API type led type connectivity. And when doing data analytics, it may be better to pretty much put that data into maybe a SQL database. But that's a much larger question. It's case by case, depending on what the data is being used for visually. So if you'd like to email me, we can set up more time to talk about the use case, and I could talk to you about the best way to get more data into Tableau, especially with my technical counterpart, Chris Gill, who's my solution engineer. I just posted my email address in there. Any questions can be directed that I don't answer today can be directed there as well. Did you help Nova Scotia move their previous state data visualization to their current one? Nova Scotia has a lot of talented people, a lot of talented organizations that are self-starters. We started this journey with the province of Nova Scotia 4 or 5 years ago when I came on board to Tableau. And then when Nova Scotia Health Authority adopted Tableau, we did a number of activities that supported enablement, adoption, and education in the beginning. The key thing about Tableau that kind of differentiates us from other technologies is that we want to enable and empower you to do more with the application, opposed to be more reliant on us or on any sort of partners. We want to be able to create teams within your organization to help support the democratization of data analytics. So yes, we helped them in the beginning, but they quickly picked it up the reins and they pioneered through it on their own. Hope that answers that question. Did Tableau provide, there's another question from Robin. Did Tableau provide project management leads, or did Nova Scotia provide their own internally as they move through their current state? So this is, again, case by case basis or project by project basis. For any client, we can provide professional services that entails project management support. We also partner with external partners to provide clients solutions, or we work with leads with the client themselves. Dave Gregg, can I confirm Nova Scotia is using Tableau Server? Yes, Matt did mention that Nova Scotia Health Authority is using Tableau Server. They're also using, as he mentioned in his one of his PowerPoint slides, that data flow, that's data management aspect, specifically Tableau Prep that handles the ETL process. And Dave, if you have any other questions, I do handle all of Atlantic, Canada, so I can help you out. There's a question from Evan Harris. Has Nova Scotia Health used Tableau for AI? There's a lot of use cases in which Nova Scotia is using Tableau. There's a myriad of products for AI. I couldn't attest to which specific use cases are being used for Tableau and AI. So I defer that one to Matthew, which scenarios they're being used. But Tableau is used for AI and predictive, and even connecting to Salesforce, formerly known as Einstein, or their CRM analytics piece, which is machine learning and AI, and embedding that into Tableau itself for predictions or what have you. So it is a common tool, or people like to bring in their own models through R and Python or SAS into Tableau as well to help address their predictive models as well, and to use them visually within the application. So it's all very common, whether you want to use Tableau itself or bring in your own applications and those models and connect them directly to Tableau. All right, seems like questions are slowing down. If there are any questions, comments that do come up after the presentation, feel free to shoot me a quick email. I did put my email inside the chat. If it's anything specific to Matt, then feel free to email Matt directly. He's a ocean of information and experience. Matt is a driver behind the analytics vision at Nova Scotia, him and team. So between him and I, we can definitely either answer the question or direct you to the right person. So with that being said, I think we're okay to close. Okay, I don't think you see my email. All right, let me repost that. Perfect. Okay. All right, if there aren't any other questions, I would like to thank everyone once again for attending the session. The recording will be made available, I believe, shortly. I think it's about a week, but I'll let the organizers address that. But the presentation will be made shortly. Or if you want the slides, I guess you could just reach out to Matt specifically. Thanks, everyone. Take care and enjoy our summer weather that's coming up, although it's not summer yet, but enjoy. Thank you.